Morning folks, Jason here with Basics of Ortho, and what I'm going to do today is my initial installment of something that I hope to continue to do, and it is more or less going to be a drawing session. Frequently with my patients, when I'm trying to explain their injuries to them, I'll pull out a pen and draw on the table paper in attempt to give them a better understanding of what's going on with the anatomy and their injury. And I've found sometimes that this also helps with learners. So that's what I'm going to do, start attempting to do relatively frequent installments where I'm simply going to draw out the pictures and explain them like I do to patients. So today we're going to start with my favorite joint. It's the knee joint. And again, we're going to do it as the very basics. We're going to start out with the bony anatomy. So we will do the knee. Alright, so the bones of the knee, we have 5 bones that make up the knee. So the first is our femur, and I'm going to go ahead before I proceed any further. By no means claim to be an artist, so please don't judge me on the quality of the artistic ability. So within the femur we have several important parts. We have our medial femoral condyle, which we'll represent as MFC. We have our lateral femoral condyle, which will be our LFC. And then we've got our notch, which is the groove that the medial femoral condyle and lateral femoral condyle form inside the articular surface. The fourth part of the femoral condyle, or distal femur, is our trochlea. So I'll represent that with a T. That's where our patella is going to sit. And the final portion of the distal femur that we'll talk about with the knee is the metaphysis, which is simply the junction of the distal femur and the shaft of the femur. So it's basically where it starts angling off. So metaphysis. Now, before we go any further, because I've labeled the inside of this one the medial femoral condyle and the outside the lateral femoral condyle, this will be representative of a left knee. Alright, so the next bone that we'll review is the tibia. And the important landmarks of the tibia are the medial condyle, the lateral condyle. Now the tops of the tibia, if you look straight down on top of it, this would be the lateral tibial plateau, LTP, the medial tibial plateau, MTP, and then in between those we have our tibial spine, so TS. Now, also in between those on the anterior portion of the knee we have our tibial tubercle, TT, and along the medial aspect we have an attachment point for tendons. The pes anserinus, which the pes anserinus is actually the tendons themselves, but we'll include that in the bony anatomy. And then lateral to that we have a smaller, lesser known tubercle called Gerdy's tubercle, which is another attachment point. And that's what makes up our tibia. So the next bone that we'll talk about sits in the trochlea on top of the femur. Okay, and that's our patella. Alright, now the portions of our patella, you have the superior pole, okay, and you have the inferior pole, and then you have the body. Alright, now within the body of the patella, if we flipped it over, so we'll, okay, Okay, so we have flipped the patella over. There's a little ridge in the middle, and there is the medial facet and the lateral facet, and that's what articulates in the trochlear groove on the femur. And then the final bone that we really don't think about too much when we think of the knee, and the reason for that is because it's not an articulating bone in the knee, is our fibula. But it is considered part of the knee because it serves as an attachment point for soft tissues. So we have our fibula. Okay, that would be the fibula shaft or metaphysis. And then we have our fibular head, FH. And these bones together form the knee. Now, when we're talking about the knee in a clinical reference, whether it be from injury standpoint or chronic condition standpoint, we will divide the knee into three compartments. We have a medial compartment, we have a lateral compartment, and an anterior compartment. Okay. The medial compartment would be, if we drew a line straight down the midline of the knee, would be everything on the medial side, and the lateral would be everything on the lateral aspect of the knee. And the anterior compartment would basically include the patella and the anterior portion of the knee, so the patellofemoral compartment. So we'll put that in parentheses, the patellofemoral compartment. Alright. And the knee anatomy is what constitutes a hinge joint. So it's a hinge joint. And the motions of a hinge joint are flexion and extension. Alright. So again, that is the very basics of the knee anatomy, the bony structures. And I hope that helps. We'll continue with each segment, and we'll introduce more aspects of the knee from an anatomical standpoint. We'll talk about their origins and attachments and their functions, and a common presentation for injury to those structures. I hope that you found this of value, and we will come together next time.